All right, let's dive in. Today, we're tackling shock. You've given me a ton of research and notes on this. Honestly, even I was surprised by some of the things I learned prepping for this deep dive.
It's definitely a topic that deserves a closer look, that's for sure. We're going to break down the different types of shock, what causes them, the warning signs, and how it's all treated.
And this isn't just like an academic exercise, right? I mean, understanding shock could actually help save a life, maybe even your own.
Absolutely. One of the things people need to understand is that shock, at its core, is all about your cells not getting enough oxygen. They're not getting the fuel they need. And if that goes on for too long, things can go downhill really fast.
So like a delivery system breakdown, instead of Amazon packages, it's the thing that keeps us alive.
Exactly. And it's even more complex because shock isn't a one-size-fits-all thing. There are actually several different types, each with their own quirks, I guess you could say.
Yeah.
Your notes mention 5 main categories we'll be going over today.
5. Okay, this is where I start to feel like I need a medical dictionary. But you always manage to make even the most complex stuff make sense. So I'm trusting you to guide us through this.
Well, let's start with cardiogenic shock. I know you flagged some pretty alarming stats about it in your notes.
Yeah.
It flips the script on how we usually think about heart problems.
Flip the script, how so? I always thought a rapid heartbeat was a bad sign when it comes to the heart.
Well, with most types of shock, yeah, your heart rate speeds up, trying to compensate, for the low blood pressure.
Mm-hmm.
But with cardiogenic shock, the heart itself is the problem. It's too weak to pump blood properly. So even if it's beating fast, it's just not getting enough oxygen-rich blood out to the body.
So a rapid heartbeat could actually be making things worse in this case.
Exactly. It's like revving the engine of a car that's out of gas. It's not going to get you anywhere. It might even cause more damage. This is why, doctors have to be really careful with medications that increase heart rate, like dobutamine, when it comes to treating cardiogenic shock.
So it's not just about getting the heart pumping, but getting it pumping the right way. What causes this kind of heart weakness?
A lot of times it's a severe heart attack or a myocardial infarction or MI.
Yeah.
But, anything that damages the heart muscle can be a factor, really. Cardiomyopathy, infections, even blunt force trauma to the chest.
You mentioned something in the notes about some scary numbers, about the mortality rate for cardiogenic shock.
Yeah, it's the leading cause of death in people who are hospitalized with a particular type of heart attack called a STEMI. And yeah, the numbers are grim. Without the right treatment, up to 90% of patients don't make it.
Okay, wow, those stats are definitely a wake-up call. Let's say someone is experiencing cardiogenic shock, what should people be looking out for?
Well, think classic heart attack symptoms, chest pain, anxiety, shortness of breath, rapid heartbeat. But you also might see signs that the brain isn't getting enough blood, things like confusion or agitation. And as fluid builds up in the lungs, you can see coughing, difficulty breathing, even swelling in the arms and legs.
So like a bunch of scary symptoms. If you see these, it's time to call 911, right?
Absolutely. Every second counts. Don't wait. In the hospital, they're going to start emergency life support, maybe help with breathing, and definitely fluids to keep the blood pressure up.
But that's just the beginning, right? I mean, there's got to be more to treating the cause of this.
Right. If it's a heart attack, they might do a procedure to open up those blocked arteries. In really bad cases, a heart transplant might be the only option. And they'll use medications to support heart function and blood pressure, things like dopamine.
Okay, so cardiogenic shock, it's a different kind of heart problem. But what about the other types?
Okay, so next is obstructive shock, which is kind of like cardiogenic shock because something is stopping the heart from working properly. But in this case, it's not the heart itself that's weak. It's that there's a physical blockage preventing blood from getting to or leaving the heart.
Like a traffic jam in your blood vessels.
Perfect analogy. Imagine like a highway suddenly being blocked off, right? The traffic backs up, nothing can move. Same idea here.
So what could actually cause that kind of blockage in the body?
Several things, actually. It could be fluid building up around the heart, squeezing it. That's called cardiac tamponade. Or a collapsed lung pressing on the heart, which is called tension pneumothorax. Even a blood clot in the lungs, a pulmonary embolism, can cause obstructive shock.
So the heart's fine, but something's getting in the way. What about hypovolemic shock? That was the one you mentioned is most common, right?
That's right. Think of it this way. If the heart is a pump, in hypovolemic shock, there's just not enough fluid to pump. Like trying to water your garden with a hose that's barely trickling.
So we're talking about blood loss.
That's one cause. Yeah, severe bleeding from trauma, internal bleeding. You mentioned ruptured ectopic pregnancy in your notes, which is, a very serious example.
Definitely a situation where every second counts.
Absolutely. But here's where it gets interesting. Hypovolemic shock can also happen without actually losing blood. It's about fluid shifting, moving out of the bloodstream and into other places in the body, like severe burns or conditions that cause fluid to leak out of blood vessels.
So not always about blood loss, but always about where the fluid is or isn't in the body.
Exactly. That's why doctors talk about absolute hypovolemia, which is actual fluid loss, versus relative hypovolemia, which is fluid shifting to the wrong places.
Okay, I see. So how does this lack of fluid actually affect the heart?
Well, imagine the heart's trying to fill up its chambers, right, to pump, but there's just not enough blood coming back to it. Doctors call this decreased preload, and it leads to a smaller stroke volume, which is the amount of blood the heart pumps out with each beat. Ultimately, this means less blood and less oxygen getting to the organs.
And even if the heart speeds up, it can't fix the problem of not having enough fluid to pump.
You got it. So what should you be looking out for with hypovolemic shock?
Early on, you might just notice cool hands and feet sweating, but as it gets worse, you'll see more serious things like bluish lips and nail beds from lack of oxygen, fast breathing, a weak pulse, confusion, and eventually even passing out.
So this is where knowing what to do even before help arrives is crucial.
Couldn't agree more. First, call 911. Then, if it's safe to do so, lay the person flat with their feet raised like 12 inches. It helps blood flow back to the heart. And don't give them anything to drink. There's a real risk of choking.
So those basic first aid steps are critical. And then in the hospital, I guess it's all about getting those fluids back up quickly, right?
Exactly. Big VVs, fluids like saline solution. They'll also be trying to figure out what caused the fluid loss, stopping bleeding, treating burns.
Okay, so we've got cardiogenic, obstructive, and hypovolemic shock so far.
Yeah.
That leaves us with, your notes say the 4 stages of shock and 2 other main categories. Right. So the 4 stages, those apply to all types of shock. Think of it as the body's reaction to things getting worse, basically. But before we get to that, let's talk about distributive shock. This one's different because it's not about the heart itself or lack of fluid. It's a blood vessel problem.
Blood vessel problem. Okay. Tell me more.
Okay, so in distributive shock, the blood vessels lose their ability to constrict properly, so they get too wide. And this causes blood to kind of pool in the arms and legs, which means less blood is returning to the heart to be pumped out.
So the heart could be working fine and there could be enough blood, but it's not getting to where it needs to go.
Exactly. And this can cause dangerously low blood pressure, even if the heart is working overtime, so to speak.
Okay. This is starting to make sense. So distributive shock is like an umbrella term, right? Because there are different things that can cause this blood vessel problem.
Exactly. There are 3 main subtypes: neurogenic, anaphylactic, and septic shock.
Okay, well, let's go through them one by one. Let's start with, let's go with anaphylactic shock, since that's probably the one most people have heard of.
Good choice. Anaphylactic shock is basically a really bad, life-threatening allergic reaction. So when someone is exposed to an allergen, they're super sensitive to, peanuts, bee stings, certain medications. Their body releases a ton of histamine.
Histamine, isn't that what makes you itchy and sneezy with allergies?
That's it. But with anaphylactic shock, it's not just a runny nose. It's a system overload, you could say. Histamine causes blood vessels to get really wide, really fast. And it also makes them leaky. So fluid starts leaking out into the tissues.
So low blood pressure and fluid loss. No wonder it's so dangerous.
Right. And to make things even worse, histamine can trigger bronchospasm, which is a tightening of the airways. Basically, it makes it hard to breathe.
Wow, a lot going on at once. What are the warning signs?
Well, definitely trouble breathing, often with wheezing or a high-pitched whistling sound, which doctors call stridor. You might also see swelling of the lips and tongue, dizziness, anxiety, confusion, even chest pain. Oh, and skin changes are common too, like flushing, hives, and even more severe swelling called angioedema.
So it's a whole body freak out, basically. What do you do if you see someone going through this?
Epinephrine and fast. That's what's in an EpiPen. And it can literally be a lifesaver. It counteracts all that histamine, constricts blood vessels, opens up the airways. Hopefully it reverses those scary symptoms.
So anyone with severe allergies should always have an EpiPen, and anyone around them should know how to use it too.
Totally agree. It's basic first aid that can make all the difference. Okay, so moving on to neurogenic shock. This one's different because it's not an allergic reaction or a heart problem. It's a nervous system issue.
Nervous system. So we're talking brain and spinal cord.
Yeah, exactly. Yeah. Neurogenic shock usually happens after a spinal cord injury, specifically in the upper part of the spine. This injury kind of disrupts the communication between the brain and the body, and it really messes with the sympathetic nervous system. That's the system that helps control, blood vessel constriction.
So it's like the body's natural blood pressure control system is shut off.
That's a good way to put it.
Yeah.
Yeah. And this leads to vasodilation, that widening of the blood vessels we talked about, which causes the blood pressure to drop.
Okay. Similar blood pressure problem, but a very different cause. Anything else unique about neurogenic shock?
So most types of shock cause your heart rate to go up, right? Neurogenic shock often does the opposite. It can actually cause bradycardia, which means a slow heart rate.
Really? That seems counterintuitive.
Yeah, it is. It happens because the parasympathetic nervous system, which normally slows the heart down, is no longer balanced out by the sympathetic system.
Huh, interesting. So we're looking for low blood pressure, but maybe a slow heart rate this time. Any other symptoms?
Yeah. Besides that, you might also see a drop in body temperature called hypothermia. But this is kind of strange. The limbs might feel warm at first because of that vasodilation.
That does seem counterintuitive.
It is, but it's temporary.
Yeah.
Eventually, the body loses its ability to regulate temperature properly, and the core temperature will drop.
Okay, so low blood pressure, potential slow heart rate, and maybe some weird temperature stuff. How do you treat neurogenic shock?
First things first, stabilize the airway, breathing, and circulation, just like other types of shock. If there's a spinal cord injury, they'll need to immobilize the spine so it doesn't get worse.
Mm-hmm.
And they might use IV fluids and medications like dopamine to help with blood pressure and heart function. If the heart rate is really slow, they might use atropine to speed it back up.
So it's about stabilizing things and dealing with those immediate life-threatening problems.
Right. Now let's move on to the last type of distributive shock, septic shock.
Yeah.
This one is often considered the most complex and dangerous of the bunch.
Your notes mention that it's not just the infection itself, but the body's reaction to the infection that causes the problem.
Exactly. So septic shock happens when an infection triggers a huge inflammatory response throughout the entire body. Doctors call this over-the-top reaction systemic inflammatory response syndrome, or SIRS.
So it's like the immune system going haywire.
Yeah, perfect way to put it. Instead of just fighting off the infection, it's attacking the whole system. And that can be worse than the infection itself.
And does this lead to that blood vessel dilation again?
You got it. SIRS causes those blood vessels to widen and get leaky, and that leads to that same dangerous drop in blood pressure.
What kind of infections are we talking about here?
Could be anything, really. Bacterial, fungal, viral, even parasitic. But usually it's gram-negative and gram-positive bacteria. And here's the scary part. The mortality rate for septic shock is around 30% with treatment. Without treatment, it's over 80%.
Whoa, those numbers are terrifying. What makes it so deadly?
Well, part of it is that the inflammation is everywhere, affecting a bunch of organ systems. And it can trigger a clotting disorder called DIC, which can cause both too much clotting and too much bleeding.
Wait, clotting and bleeding at the same time? That sounds like a recipe for disaster.
It can be. And if septic shock isn't treated, it can lead to complete organ failure, which is called multiple organ dysfunction syndrome, or MODS.
We talked about MODS a little bit at the beginning. That's where multiple organs start shutting down. Not a good situation at all.
No, definitely not. But recognizing the signs early and getting treatment as soon as possible can really improve those odds of survival.
So what should we be looking out for?
Well, early symptoms are often subtle fever, chills, rapid breathing, fast heart rate. As it progresses, you might see patches of discolored skin, especially in folks who've had surgery recently, decreased urination, really low blood pressure, confusion, lightheadedness, shortness of breath, extreme weakness, all bad signs.
So all wide range of symptoms, but acting fast is key.
Absolutely. Treatment for septic shock is aggressive. IV antibiotics are the first line of defense. They'll also use medications to raise blood pressure, support heart function, and sometimes even surgery to get rid of the source of infection.
Got it. So a multi-pronged attack to fight the infection, support the body, and get that inflammation under control.
Exactly. And, it's important to remember that septic shock doesn't just appear out of nowhere. It usually goes through stages from SIRS to sepsis to severe sepsis, and then finally, full-blown septic shock. And at any point along the way, it can lead to MODS.
So it's a slippery slope, but understanding that progression helps us recognize the warning signs earlier.
That's exactly it. Now, you mentioned the 4 stages of shock. Those are really helpful for understanding how the body responds as shock progresses, no matter what type it is.
Okay, so let's get to those stages. Walk us through what happens inside the body as shock gets worse.
All right, well, it all starts with the initial stage. This stage is often silent. There aren't any noticeable changes in vital signs. But at the cellular level, things are already going wrong. The cells aren't getting enough oxygen, so they switch from their normal energy production, which needs oxygen, to a backup system that doesn't. It's less efficient, though.
So the body is adapting, but it's running on fumes, so to speak.
Exactly. And this backup system creates lactic acid as a byproduct, which starts to build up.
So the initial stage is like a warning light, even if we can't see it on the outside.
Yeah.
What happens next?
Next is the compensatory stage. This is where the body goes into full fight or flight mode. It's trying to keep blood flowing to the vital organs, so the sympathetic nervous system kicks in, releases hormones that increase heart rate and constrict blood vessels.
The body's trying to fix the problem, basically.
Exactly. You'll see rapid breathing, agitation, even higher blood sugar. But if the root cause of the shock isn't addressed, the body's efforts will eventually fail.
And that's when we move into the progressive stage.
Right. The lack of oxygen is taking its toll. The capillaries, those tiny blood vessels, they become leaky, fluid leaks out into the tissues, blood pressure drops even more, you get swelling throughout the body, you might start to see mental changes like confusion, and the metabolic and respiratory acidosis, those get worse as the organs start to struggle.
This is where it gets really serious.
It is. And if it progresses to the final stage, the refractory stage, it's often a point of no return.
Point of no return.
Yeah, sadly. The organs have failed, blood pressure is super low, and the body just doesn't respond to treatment anymore. There's widespread brain damage, cell death.
Yeah.
Death is likely at that point.
Wow. That really drives home the importance of catching and treating shock early on.
Absolutely. Early intervention is key. Welcome back. So we've just scratched the surface of shock, but I hope you're starting to see how important it is to understand this.
Absolutely. It's like we're building a puzzle. Each piece of information gives us a clearer picture, like how shock works, why it's so dangerous.
That's a great way to put it. And speaking of important pieces, we can't really talk about managing shock without mentioning nurses. They play a huge role.
Yeah, for sure. Nurses are the ones right there with the patients. They're the ones who catch those little changes that could be a sign of trouble.
Exactly. They're like shock detectives, constantly looking for clues, piecing everything together to make sure the patient gets the right care at the right time.
Okay, so what are some of the things nurses focus on when they're caring for someone in shock?
Well, the ABCs are always the top priority, right? Airway, breathing, circulation. They're constantly checking the patient's breathing. Someone is struggling to breathe, they might need oxygen or even a ventilator.
Makes sense. Breathing is pretty important.
Just a little bit. They also keep a really close eye on those vital signs: heart rate, blood pressure, respiratory rate, temperature, looking for any sudden changes that could mean the patient's condition is changing.
So constant vigilance, early detection.
You got it. And it's not just about the numbers on a screen. They're also looking at the bigger picture. Skin color, how fast the color returns after you press on a fingernail. Doctors call that capillary refill time. It's a quick way to check circulation. And they're checking the patient's level of consciousness, too.
So capillary refill time, that's like a little test to see how well the blood is flowing in those tiny vessels.
Exactly. It's a simple test, but really useful. Nurses use it all the time.
What about fluids? Like how much is going in and out? That seems like it would be really important, especially with hypovolemic shock.
Super important. They track every drop of fluid, IVs, anything the patient drinks, everything, and how much they pee out.
Right.
It helps them figure out the patient's overall fluid balance and make sure they're not getting overloaded with fluids or dehydrated.
Right, because too much fluid or too little fluid could mess up their blood pressure and circulation.
Exactly. And on top of all that, nurses are the ones giving medications, making sure those inotropes, vasopressors, antibiotics, all the drugs we talked about are given the right way. They're watching out for side effects or bad reactions, too.
So they're basically the eyes and ears of the medical team.
That's a great way to put it. They're observing, assessing, and taking action to make sure the patient is getting the best possible care.
Now, we've talked a lot about the medical side of shock, but I imagine going through something like this must be incredibly scary and stressful for the patient and their family.
Absolutely. Shock is a life-threatening condition. So yeah, there's a lot of fear and uncertainty that comes with that.
For sure. So, how can nurses and other healthcare providers offer support during such a difficult time?
Well, clear communication is key. And empathy, of course. Explaining things in a way that makes sense, answering their questions honestly, just, offering reassurance and listening to their concerns, those things can make a huge difference.
I imagine just being present and acknowledging how scary it is would be helpful too.
You're absolutely right. Sometimes a kind word or a comforting touch can go a long way.
Now, you mentioned earlier that DIC, disseminated intravascular coagulation, can happen with septic shock. Can you explain what's going on in the body with that?
DIC is tricky. It basically involves too much clotting and too much bleeding at the same time.
Wait, so the blood can't decide whether to clot or not?
It's like that, yeah. It's usually triggered by something major, like a bad infection, trauma, or certain types of cancer. And the body's clotting system just goes into overdrive. It starts forming tiny clots all over the bloodstream.
And those clots are a problem because...
Well, they can block those tiny blood vessels, which stops blood from getting to organs. That causes damage. But here's the weird part. While the body's making all those clots, it's also using up its clotting factors and platelets, which are the things it needs to actually form clots properly.
So it's like using up all the ingredients while making too much of the product at the same time.
Exactly. And that's where the bleeding part comes in. If you don't have enough clotting factors and platelets, the body can't stop bleeding when it needs to.
What are some signs to watch out for if someone might have DIC?
Well, it depends on how severe it is. You might see bruising that seems to come out of nowhere, bleeding from the gums or from, where an IV is, blood in the urine or stool. Those are all signs of bleeding. But then, on the other hand, you might also see pain, swelling, redness in the limbs. That could be a sign of clotting.
Okay, so a lot of different symptoms. But anything unusual with bleeding or clotting should be a red flag.
Exactly. And in really severe cases, DIC can lead to organ failure, even death.
So definitely something you want to catch early. How is DIC treated?
The most important thing is to treat whatever caused it in the first place. So if it's from sepsis, they'll focus on fighting that infection. They might do blood transfusions to replace the clotting factors and platelets. And sometimes they use medications to try to, control the clotting.
So support the clotting system while fixing the root problem.
Exactly. Now, let's talk about MODS, or multiple organ dysfunction syndrome. We mentioned it a few times, and it's a possible complication with any type of shock, especially septic shock.
So from what I understand, MODS is when two or more organ systems start shutting down. That's bad, right?
Yeah, it is. It's the worst thing that can happen with shock. It usually happens because of, a combination of things, low oxygen in the tissues, inflammation, and the release of toxins from those damaged cells.
Like a domino effect, one organ fails, stresses out the others, and then those start failing too.
That's a really good way to describe it. And as more organs fail, the body can't keep things balanced anymore. It just leads to a whole bunch of complications.
Are there any organ systems that are usually the first to go?
The lungs are often the first to be affected. It leads to something called acute respiratory distress syndrome, or ARDS. The kidneys are also pretty vulnerable, and acute kidney injury is common. But the heart, liver, brain, and GI system can be affected too.
So no organ is safe from MODS, basically. What kind of symptoms might you see?
Well, it really depends on which organs are involved. Trouble breathing if it's the lungs, low urine output if it's the kidneys, jaundice if the liver is struggling. It can be a lot of different things, because there's so much damage.
So the more organs are failing, the worse the outlook.
Yeah, unfortunately, that's true. MODS has a high mortality rate, and the more organ systems are involved, the lower the chances of survival.
This is pretty intense. How do doctors even treat MODS?
Honestly, treatment is mainly supportive care. Trying to keep the other organs working and prevent things from getting worse. This could involve things like mechanical ventilation, dialysis, medications to support blood pressure and the heart, nutritional support.
So buying time and hoping the body can recover.
Exactly. But honestly, the best way to treat MODS is to prevent it in the first place. Recognizing the early signs of shock, acting quickly, and getting medical attention right away.
That's a really good point. We've learned a lot about these more complex issues today. DIC, MODS complications you really want to avoid if possible.
I completely agree. And that's why recognizing and treating shock early is so critical.
All right, welcome back to our deep dive on shock. So far, we've been getting into the details, the different types of shock, what happens as it gets worse, even some of those more complicated issues that can come up. But now let's talk about what you can do if you think someone might be going into shock.
Yeah, good idea. We've covered a lot of information, but you got to know what to do with it,
Yeah,
right?
let's turn knowledge into action. What's the first thing you should do? Like the absolute first thing if you think someone might be in shock?
Call for help. Don't even hesitate. 911 or your local emergency number, whatever it is,
Yeah.
every second counts with shock, so don't wait around to see if it gets better.
Okay, call 911. Got it. What about while you're waiting for the paramedics? What should you do?
Okay, so if it's safe to do so, help the person lie down, flat on their back,
Yeah.
and prop up their feet like 12 inches or so. It helps to get blood flowing back to the heart.
Lie them down, feet up. Got it. Anything else?
Yeah. Make sure they're comfortable and try to keep them warm, maybe with a blanket. But don't, overdo it. You don't want them to get overheated.
Okay, good point. What about giving them something to drink? I feel like I've heard that somewhere. Like, give someone in shock a sip of water.
No, that's actually a myth. Don't
Yeah.
give someone in shock anything to drink. They could choke, and it could cause problems when the paramedics get there and need to start treatment.
Good to know. No food or drinks. Should you check their pulse?
You can if you know how, but honestly, don't worry too much about it. Focus on the bigger picture. Are they breathing? Are they responsive? Those are the most important things.
Right. The ABCs, airway, breathing, circulation.
Exactly. And if they stop breathing, you'll need to start CPR if you're trained.
All right, so far we've got call 911, lie them down with their feet up, make sure they're comfy and warm, nothing to drink. Anything else we should keep in mind?
Yeah, if there's any obvious bleeding, try to stop it. Direct pressure on the wound. And if you think there might be a spinal injury, like maybe after a fall or a car accident, don't move them unless you absolutely have to. Keep the head and neck as still as possible.
Got it. So those are the basics, but how can you even tell if someone is in shock in the first place? What should you look out for?
We talked about some of this, but it's worth repeating. Those early signs can be really subtle. Pale skin, clammy skin, breathing fast, heart beating fast. Pay attention to those. And as it gets worse, you might see things like confusion, anxiety, dizziness, weakness, a weak pulse.
And you mentioned blue lips and fingernails being a sign that the body isn't getting enough oxygen.
Right. That's called cyanosis, and it's definitely a bad sign.
Yeah.
Other things to watch out for are low blood pressure, peeing less than usual, and then eventually losing consciousness.
So a range of symptoms, from those early subtle ones to the more serious life-threatening ones.
Exactly. And not everyone's going to have all the same symptoms,
Yeah.
It depends on what kind of shock they're in, what caused it, and their overall health.
This is why knowing those early signs is so important. Catching it early makes a huge difference.
I couldn't agree more. So the bottom line for everyone listening,
Mm-hmm.
shock is serious. It's an emergency. If you know the signs and you know how to react quickly, you could save someone's life.
Well said. And if you want to learn more, do your own research. Talk to your doctor. There's tons of information out there.
Absolutely. The more you know about your health, the better you can take care of yourself and the people around you.
All right. That's it for our deep dive on shock. I hope you learned something new. And until next time, stay curious, stay informed, and stay well.